everybody, it's Dina the dietitian, Dish with Dina. Today is Tuesday, January 27. I am keeping up with my daily vlogs this whole week to give you a little insight into the week of a life of what I think is an unconventional or non-traditional registered dietitian. I do quite a lot of different things, and I thought it'd be kind of cool to share some of that with you, whether you are on this path of becoming a dietitian yourself or a healthcare provider of some sort, or if you are interested in collaborating with me after you see all of what I do and juggle, if that's interesting to you, or just some insight into what a healthcare provider can do. Not everybody works in a clinical setting. Not everybody has a traditional 9-to-5 Monday through Friday role. Today is mostly patient counseling for me. So what that means is I am working from home. So I have a telehealth platform that I work on, and I have a very part-time private practice. So I carve out about maybe 20 hours a week or so, and I can see up to about 10 or 12 patients in that time every week. I do take insurance, and because of the nature of my profession, because it's telehealth specifically, I am also able to see patients across certain state lines. Not the entire country, but definitely I think there's like 10 or 12 different states that allow me to do telehealth for those patients. And that's kind of cool because I live in New York City, and obviously there's 8 million people here, but across the United States, we have about 112,000 registered dietitians, and they are concentrated in more of the big cities. So some places in the United States don't really have as many dietitians as is needed. And a lot of doctors, unfortunately, don't necessarily know or value the role of the registered dietitian, and so they might be giving out some information, generic or incorrect, that could do more harm than good. So I really appreciate the ability to be able to work with a variety of different clientele, different patient populations. And so as an example, most of the people I work with are women. Most of them are dealing with just general health issues, but I also see young children. I see a 15-year-old, a 16-year-old. I also see people in their older adult years, 60s and 70s. And some people are just looking for general guidance to help them with establishing or fortifying their healthy habits. And some of them actually have some chronic conditions or have been told they are at risk for something like high cholesterol or kidney disease or anything else that unfortunately comes up in their physical exams. Now, this is January, as I'm sure you can imagine. A lot of people will kick off the new year with a reset, or this is also the time where everybody's insurance resets as well. So now they're going back to their doctors and learning a lot more about what to take from whatever their results are. And so I get really, really busy in these months. Now, I do take insurance. I do take about, I think, 6 or 7 different types of health insurance. And if you're unfamiliar with the US healthcare system, it's mostly employer-based. So when you're working for a company, they'll provide you with their form of whatever health insurance, like United Healthcare, Cigna, Aetna, etc. And some people also can do out-of-pocket expenses or a self-pay option, or like me, in a private practice, if somebody is self-employed, they can shop around the marketplace and purchase whatever is, financially available for them to cover their insurance. Now, that said, every insurance is very, very different as far as the coverage, the services, the amount of visits. I am considered a specialist. So the challenge there is I'm working with people who are purposely in need of something other than going to their general practitioner or their primary care physician. And so they come to me as a specialist since I am the expert in nutrition, and I can help guide them in a much more individualized and nuanced way. But some of the insurances only cover like 3 sessions and or are limited to 60 minutes a session. So ideally, especially when I'm first starting out with a new patient, I would really like to see them every single week, and then we can spread it out to maybe every 2 weeks and then maybe every month, depending on how much hand-holding they need or how complicated their condition is. And then as the year progresses, or as the months progress, we meet maybe on an as-needed basis, or they check back in with me if they have any updates the next time they go to their doctor. So if they're only going once a year for their physical exam and just coming for general guidance, we can maybe space those sessions out a little bit more. If they really have something complicated or are currently managing a diagnosis, then I might see them more often, because odds are they're going back to their doctor every few months to get updates as well. And sometimes I'm looped into that conversation and sometimes I'm not. It depends on what their insurance and their providers and what the patients want to do too. So I share this all because if you're watching this and you're a provider, you get it. But if you are a student coming up the ranks and you're looking to do your own thing, like private practice, like what I do, it can be a bit challenging because you want to, you're trying to be of service and you want to do what is best for the patient, but there might be some little roadblocks in the way when it comes to health insurance. So I thought I'd give you a little bit of an insight into that. My portal is set up through a telehealth platform called Berry Street. They're very big on social media. They do a lot of advertisements. And since I'm a private practitioner and I'm solo, like I have no staff, I'm not in a group practice or anything like that, and I quite literally work out of my home office, they help me with all of the billing, the coding, the pre-approvals, the eligibility, and some of the scheduling too. And I use their telehealth portal, which is HIPAA compliant, so it's 100% secure, and I'm able to meet via video sessions with my patients. And then I can document all of my notes on there. I can review that. I can share a summary with the patients through the telehealth portal because they have an app that they can communicate with me. They can upload labs or food logs if they want to. And I actually there's a feature in the portal itself, which is very, very helpful because creating an individualized meal plan for anybody is very time consuming. So we plug in somebody's likes, dislikes, cultural, traditional foods, anything they might be allergic to, if they have like GI issues, and then the portal generates a very specific meal plan for them for 7 days. So it gives them a variety of main meals and some snack choices as well. And I always tell people it's nice to have it as a guide, like use it as inspiration. You don't have to adhere to it to the T unless you want to. But some people who are just caught up in overwhelm when it comes to planning their meals or are not sure where to start or don't have the budget or the time, right? Time or money budgeted in order to do this, I feel like it's helpful just to give them some guidance. So the meal plans that I provide for them aren't always just, 100% whole foods and organically grown everything. I really try to make sure I'm sticking to what makes most sense for them, what is realistic for them too. So I'm not opposed to, canned tuna or pre-made roasted chickens from your deli counter at your supermarket. It's going to be available to you financially, accessible, location-wise, and then you'll eat it. Makes me feel a lot better than trying to figure out how to make stuff work if it's completely outside of their realm, whether it's too expensive or, any other kind of barriers that hold up. So I hope that was kind of interesting. I'm going to check back in a little bit later in the day because today I do have to run some errands. I have some spaces in between my calendar because unfortunately my first patient was a no-show, which, just a PS, yes, in the portal when they sign up, they have to sign about financial responsibility, and we do charge for no-shows. I can't bill that through the insurance, and if somebody doesn't show up, I can't immediately go and fill that slot anymore. Like, that's gone. And the way it works with private practice is I'm not on somebody's payroll. I am here, and if my patients don't show up, I don't get paid. But that said, I will usually grant somebody a courtesy waiver for the first time that something like that happens, just to establish a good rapport. And things happen, you forget stuff, wrenches get thrown in your plan last minute, so I want to make sure that it's a little bit more flexible. While I am getting ready for my next appointment, I wanted to also show you the nutrition care process. So as a dietitian, we have a universal terminology that we use in order to work with our patient population. And this is a paid subscription database that I'm on here right now, but because I am also an adjunct lecturer at one of the colleges here, I can access this for free, thank goodness. So what we do is we assess our patients. So we meet with them, we get to learn a little bit more about who they are and what's going on. We check all the biochemistry things, their food history, anything else we need to know about, like if they had recovered from surgery or they had certain family history issues. And then based on their current concerns, we have what are known as our PES statements, our problem, etiology, signs and symptoms statements that go into how we diagnose our patients. And we're not talking diagnosing them like they have high cholesterol. We're talking about a nutrition diagnosis that has to do with one of three domains, either something that they are involved in with their intake so what they are eating and drinking, whether it's something related to a clinical issue, like if they have gastro issues, or if there's a breastfeeding difficulty, or there's a behavioral environmental issue, meaning that they either don't have access to food or there's some sort of barrier or obstacle that stands in their way. And so when we create our diagnosis for our patients, we can use one or two or all three of these things, and then that helps determine the next steps for us. So we create those goals for the patient. The patient tells us what is realistic, what they can do, how we chip things away, and we work towards being able to make them feel successful at whatever it is they're doing to manage their condition. I am done for the day. It was long. I will say some of the takeaways that I want to share when it comes to patient sessions. Actually, I think a few things. So the first one is, for me, it is very exhausting. It's a lot of listening and processing and helping people get to where they need to go. But one of my patient sessions today was scheduled for 60 minutes, and I think we wrapped up in about 45 or 50. And another one of my patient sessions was scheduled for 90 minutes, and we wrapped up at about 95. So in that time, I am strategizing with people. It depends on what they want to talk about. And one person is going to be going on a work trip, so she wanted to strategize about what to do while she was outside of her normal environment and what she needed to eat and other kind of things to support her healthy habits. And the other patient that I had was new. She was a new patient for me. So we're still kind of getting to know each other. And our patient session the first time was just a lot of admin things, collecting information, getting to learn her family history, etc. This time around, it was kind of like, how did it go since the last time we spoke, and what successes or challenges did you have? Did you notice that you were more mindful about things after our conversations? And then let's launch into some education and some counseling. So what that entails is really a little bit of everything. Sometimes people bring to me their blood test results and they're not sure what it says, and doctors sometimes don't explain very well what they're looking at. But if I can see the labs beforehand, then I can give the patient some information of what they can ask their doctor in order to be clearer about what they need to know. And then I'm also looking at it from the standpoint of nutrition and food. So if there is anything that I need to be concerned about, or that I think should be part of her treatment plan, their treatment plan, then I can let them know ahead of time, and then they can go to their doctor and say, I'm working with my dietitian and we're already addressing these things. The next thing I wanted to share was about self-disclosure. So a lot of times when we are working with our patients, depending on the facility, the organization, and the clientele, we don't want to divulge everything about our own personal lives, but I think people appreciate hearing that their healthcare provider is also human. So if, for example, I suffer from high blood pressure and high cholesterol, so I'm a dietitian, but I'm also dealing with normal patient things coming from it from just a human standpoint. And so I like to share a little bit about my method, my thoughts about things, maybe some of the struggles that I had when I first found out about it, things that did or did not work for me, and then provide the patient that I'm working with a more nuanced approach as to whatever it is that their situation entails, then also critically thinking from my professional end of things, and then giving them some other ideas or thoughts based on my personal situation. So I think they appreciate that. A lot of the feedback I get, I'm not like commandeering the session. The patient is still the patient. It's just dropping little bits of nuggets to just say, I want to make you feel more comfortable, or I understand what you're going through, or I have other patients that seem to have the same issues. And the feedback that I've gotten from my patients is that, well, generally speaking, I think that there's strength in vulnerability. I think anytime we can kind of let our guard down a little bit and just be compassionate to other people, there is good reception of that. And then it also makes people feel at ease, because a lot of times people come to me thinking they have to do all the right things, or that I'm going to judge them. And, they do that because they might have had previous experience with other healthcare providers who have done that, who have made them feel like that. I do not do that. I am part of, thank goodness, a new generation of dietitians who focus on patient-centered care and try to be what we call trauma-informed. So if people are coming to us with experiences from childhood or abusive relationships or anything along those lines that's going to affect how they have a relationship with food, with their body, with their health, then it creates a more compassionate and supportive environment for them. On my end, so in between all the things, when I'm busy like this, I pick. So I had like half a sandwich earlier, I had half a sandwich now. Sometimes I'll have a piece of fruit or something. I really try not to make a big deal out of it because it's just one day that's very long. But I do try to feed myself as best as I can in between all the things. It is currently 7 o'clock or so, so I'm gonna run downstairs and do a couple more loads of laundry before I call it a night. Tomorrow, I'm going to be on site at a school, what's known as a Head Start school. So I work with the family workers, the directors, the chef there, and also I get to observe classroom settings with children ages 3 to 5 or so. So that's a whole different patient population and a whole different job that I have. So I'll talk a little bit more about that tomorrow. That's gonna be Wednesday. So thanks again for watching. I hope that you're finding this insightful and interesting, and if not, that's okay, because I like to share and just kind of like document, and it makes me feel good to know that I'm doing a little bit of everything, and that's exactly what I set out to do. So have a great night, everybody. Until next time.